My name is Kate Fisch. I'm the Associate Vice President of Clinical Services for the Odyssey Eating Disorder Network. So anorexia nervosa, we usually just say anorexia, is a biologically based mental illness that shows up as extreme weight loss to the point of malnourishment. The people who have anorexia have an intense fear of gaining weight, they have an intense fear of being fat, and they also judge themselves negatively based on their body shape and size. There's two different types of anorexia. There's a restricting type of anorexia and there's binge purge type anorexia. So only about 20% of people who are diagnosed with anorexia are restricting type. These people don't use any type of compensatory behavior, rather they just restrict their food intake. People with binge and purge type anorexia might restrict, that results in a weight loss or a low body weight, yet there are times where they're binging on food and then purging to compensate for calories that they've taken in during the binge. Anorexia binge purge type is where we have restriction of food intake, but there are times where an individual will binge on food and then purge in an effort to compensate for any calories consumed during that binge. For treatment of anorexia, the best practice includes a treatment team approach. So we will have a therapist, we will have a dietitian on board, we will have a physician on board, and we really treat anorexia from this three-pronged approach. So especially in a residential setting, weight rehabilitation, weight restoration is really the initial focus. It's once we have restored nourishment in someone with anorexia, only then can we really get any therapeutic work done. So sometimes in residential level of care, often it begins in the partial hospital level of care. We really focus on what is underneath. Eating disorders aren't about food. And so with treatment, we are looking at how to replace eating disorder behaviors with more constructive strategies to deal with distress. We use evidence-based treatment modalities such as acceptance and commitment therapy, dialectic behavioral therapy, cognitive behavioral therapy as a way to really peel back the surface and understand what's really going on, what is the purpose of the eating disorder, and then these treatment modalities also help the individual develop new skills that can replace these destructive coping mechanisms with strategies that are way healthier with dealing with distress.